If you're watching this video and you have the flu, the good news is that most people recover within a week or two, but there are many things that you can do to help aid the recovery and help you get better sooner. So that is exactly what we are going to talk about in this video. Flu and cold symptoms can be similar, but with flu, there is a sudden onset of symptoms such as fever, headache, aching muscles, severe weakness, chills, and respiratory symptoms such as cough and difficulty breathing. With cold, the symptoms are gradual in onset and are often upper respiratory, meaning a stuffy nose, sore throat, and sneezing. Flu is typically worse than a cold and more likely to cause complications. The most common symptom of cold and flu is sore throat and cough. The best treatment for this is first to make sure you're drinking plenty of water. Taking regular sips of water can help soothe your throat and help thin excess mucus that could be irritating your throat and causing you cough. You should aim at 8 glasses of fluid a day. Second, you can try gargling salt water. The salt helps get rid of excess mucus and provides temporary relief for sore throat and potentially stopping the coughing. And it also helps reduce inflammation. To make the saline solution, boil some water, use a half teaspoon of salt, pour it in a cup of water, mix it and let it cool so that you won't burn yourself. When cool, you can gargle and then spit it out. Do not swallow the solution. This is only recommended for adults, not children. Also, keep salty water clearly separate from any drinking water. The salty water is not suitable for consumption. You can also try lemon, honey, and ginger tea. Ginger helps soothe your throat by relieving inflammation. If you do not like ginger, you can just drink lemon and honey tea. You should never give honey to a child younger than 1 year old as it contains botulinum spores. While they are usually harmless to older children and adults, infants' immune system aren't able to fight them off. Also, sucking on cough drops and medicated lozenges can be helpful. They look like hard candy but contain antiseptic. Use caution when giving lozenges or hard candy to children because they can choke on them. If all the above doesn't work, you can try local anesthetic spray. They can help numb your throat and help reduce the pain, but please be aware that if you use local anesthetic, it can make the whole mouth numb. Lastly, you can try anti-tussive cough syrup such as Robitussin. They work by reducing the cough reflex. This lessens the desire to cough, making them especially beneficial if you have dry cough. Some cough syrup contains codeine and are only available by prescription. Now we are going to talk about how to get rid of blocked nose, runny nose, mucus, phlegm, and catarrh. The first thing is saline rinse. You can use over-the-counter saline nasal spray and drop, or you can use the same solution that you use in gargling and use a Yeti pot. It will help you breathe easier by getting rid of any inflammation and excess mucus. In infants, it is recommended putting several saline drops into one nostril, then gently suctioning that nostril with a bulb syringe. To do this, squeeze the bulb gently, place the syringe tip in the nostril about 1/4 to 1/2 inch or about 6 to 12 centimeters and slowly release the bulb. Saline nasal spray may be used in older children. Second, you can use vapor rub. They contain menthol, which can help open up the airways and help you breathe better. Thirdly, you can use petroleum jelly like Vaseline under the nose if it becomes raw from wiping with tissue. Number 4, you can use humidifier and steam treatment. You can sit in a steam-filled room to temporarily decrease congestion. If you do not have a humidifier, you can take a hot shower, and the steam from the hot shower will help decrease congestion. If all the above doesn't work, you can try nasal decongestants such as Sudafed, but remember you can get rebound congestion from them if you use them for more than 3 consecutive days, which means your blocked nose will get worse. When you buy over-the-counter medication, please always run it by your pharmacist to make sure it's okay for you to take it. The next section is headache, temperature, muscle, and body ache. For this, make sure you are resting and giving your body time to recover. You can also use over-the-counter medication such as Tylenol, Motrin, and Aleve. However, if you're treating a child with flu, it's important to only give medications that have been recommended by your doctor. You should never give aspirin or acetosalicylate acid to children or teenagers who have the flu, since it comes with a small risk of causing a potentially fatal Ray's syndrome. And always remember to talk to your pharmacist when you're buying any over-the-counter medications to make sure that they're okay for you to take it. Hopefully, you won't need to see a doctor or go to the emergency room. But here on these slides are some of the symptoms that you need to go to the emergency room. For children, especially infants and toddlers, they can experience other unique symptoms that can indicate something more serious is going on. So go to your nearest emergency room if your child is having any of these symptoms that are listed on the bottom of this slide. What should we do to prevent the transmission of flu? Getting your flu shot is the first and best defense against the flu, but even if you receive your flu shot, you can still get the flu. Flu vaccine reduces the risk of flu illness by 40 to 60%. Number 2, avoid close contact with people who are sick. When you are sick, keep your distance from other people to protect them from getting sick. Number 3, stay home when you're sick. Avoid contact as much as possible. If another person is unwell, offer them support from afar. Number 4, always remember to cover your cough and sneezes. Wash your hands regularly with soap and water. When soap and water is not available, you can use alcohol-based sanitizer. Number 6, avoid touching your mouth, eyes, and nose unless you're sure your hands are clean. Number 7, practice good health habits like getting enough sleep, managing your stress, drinking plenty of fluids, and eating nutritious food. These basic measures may be our most powerful weapon when it comes to flu. Thank you for watching. If you haven't, hit that subscribe button now to get more videos.